Good morning, Wei.
Good morning.
How's your morning so far?
Great, thank you. And yourself?
Pretty good. Thanks very much for spending some time with us to
Pleasure.
help us understand how exercise can help us.
Forward to it.
Yeah, the most common question that patients ask me is that why should I exercise? Even so, I told them that's no should. But can you please go through with us the benefits of exercise, because you are the physiotherapist as well as a strengthening and conditioning coach.
Absolutely, I'll do my best. It's always a difficult question to answer because it's a very complex answer, so I'll try and keep it quite simple today. So, as a physiotherapy practice, as an exercise rehabilitation practice, we certainly use exercise as a large part of our treatment intervention. So just to list some of the benefits. The short-term benefits are it's fun and it makes you feel good and it makes you happy. So I mean that's a great benefit for people that are in pain. I certainly say to clients all the time that exercise is an antidepressant. It's great, and they all agree with me there. Again, being a physio practice, we use exercise to reduce pain, so it helps with pain management.
That's very common, isn't it?
Yeah, I mean most people that come to physio practice are in pain when they come, so we're trying to reduce their pain and manage their pain and help with their pain. We also use it to improve strength and improve capacity and improve function. So we're using exercise to be able to get people to do things that they can't do
So can you give us some examples?
Yeah, absolutely. So it could be as simple as I can't walk up the stairs anymore because of my knee pain. So we would use exercise to reduce their pain. Use the steps and some of the small things we have around here to help them walk up the stairs pain-free again.
I like the colour balls.
Yeah, that's right. It doesn't have to be a complex intervention. Reducing the pain in their knee, getting a bit of strength into their leg muscles and their hip muscles, and they can start to walk up the stairs again. Some other examples. I've got fathers, I can't play with my kids on the ground because my shoulder hurts. So then we work on their shoulder and then they can get on the ground and play with the kids again. So walking up the stairs, playing with the kids, there's some simple day-to-day things. It could be as, I can't put things in the top cupboard anymore because my neck hurts. So these things interfere with people's lives.
Okay, so what kind of exercise and how much? That's another question I get a lot. And we've got an expert here.
What exercise? Again, I think I've said to you before, like the true answer is always it depends. It depends on multifactorial things, but to try and keep it simple for our clients. The best type of exercise is the one that you're actually going to do. That's a good starting point. So there's no point giving someone a gym program if they don't like going to the gym, because they're not going to stick with it because we've put them in an environment that they don't enjoy.
They're not comfortable.
They're not comfortable and they don't enjoy it. I'm a firm believer, or we're a firm believer, that everyone should be lifting weights and doing resistance work, but it doesn't have to be in the gym. It's written in the Australian Physical Activity Guidelines now that all Australians should be doing resistance work twice a week. So that doesn't mean you have to be in the gym lifting heavy weights, but we need to be keeping our muscles strong as we get older. So the best type of exercise is the one that you're going to enjoy, and the one that you're going to do, because it all comes down to doing it for long enough to get the benefits. So if you like swimming, let's start swimming. If you like walking, let's start walking. I mean, that leads us to the on a Wednesday morning at 6:15. We run but we invite people along to our weekly health walk.
And I love the beach.
Just walk along the beach at Surfers Paradise. The sun's usually shining. A little bit of vitamin D and some exercise, and it's just some social interaction as well.
I think that's a fun bit, isn't it?
Such a huge important part of exercise. Getting you out of the house or out of work even, and interacting with people.
So
out of bed, that's right. And the other thing with exercise is just setting realistic goals as a starting point. I've certainly seen many clients over the years that just set the bar too high to start with. Like, right, starting today I'm going to go to the gym 5 days a week. And I've never done that before, but I'm going to do it. They don't tend to stick with it. It's probably better that we have a discussion with them and say, how about we start with twice a week? Not hard, twice a week, easy to moderate. Let's do that for a month first. Get a little win underneath your belt before we make it harder. Otherwise they tend to just fall off and then stop again. Yeah.
So can I just ask, so if a client comes to you, can we just have a quick understanding of how you help them?
Yeah, absolutely. So we believe that within these four walls anyway, in a rehabilitation centre, that no exercise should ever be given to anyone without an assessment. Because otherwise there's guesswork involved.
And they can get injured.
They can. There's no such thing as a bad exercise. There's just the wrong exercise for that person. Okay. It's very common for us to get asked, what's a good exercise, what's a bad exercise? I have to assess your body before we can give you an exercise. So, what we tend to do is a really thorough assessment of the whole body, because that information will let us select exercises which are going to be right for that person. So we will look at everything from the toes to the fingertips and the neck and the back, see how everything moves, what moves well, what doesn't move well, what's tight, what's weak, what's not stable, what is stable, and then we tend to prescribe exercises to fix all those parts or better move those parts as well. So it might be using the cable machine, it might be some resistance bands that we've got up here, it might be some exercise balls, but a bit like your question earlier, we have to take into consideration what the client has access to, outside the practice as well. So we'll often ask, what do you have at home to use? Because that's what we need to build your program around. Otherwise there's just barriers there if we don't actually select things that they have access to.
Well, thanks very much, Lee.
You're welcome.
That's very informative. So if anyone has any questions, please contact Lee and he'll help us. Thank you.